Warm regards to all our viewers. We are back again today with a very important topic on obesity. Myself, Aarti Bhalerao, and I'm the head dietitian with Symbiosis University Hospital and Research Center. We all know obesity is the next pandemic, and the gravity to it, India is proposed to be the next capital for obesity. So that grave is the problem, and we all know this problem, but then we are all confused. What is the treatment? When do I see the doctor? Which doctor to be seen? And what are the treatments that I should be seeking? Now, to resolve all our confusion, we have with us two most eminent specialists and who would be guiding us today on this topic. We have with us Dr. Samrat Jankar. He himself is a bariatric surgeon and a gastrosurgeon, and we've got with us Dr. Ragini Bhake, who is a consultant endocrinologist. So we would be having them involved with us and enlighten us on this topic. Now, I come to the topic, sir and ma'am. Now, the first question to you, both of you, I would like to address it to madam first, and then, sir, I would like you to add to it also. Ma'am, when is that you want the patient to come to you for obesity or seek treatment for obesity?
The starting point will be if you're obese. Now, what you want to know is how do you know whether you're obese? And so there are various ways of measuring obesity, but the simplest way that a person can do is Google BMI. And so if you put body mass index or BMI, there are various calculation tools, and you can do it very easily. Put your height and your weight, which almost everybody knows. And if it says that you're in the obese category or overweight category, you need to get help. That's as simple as I can put it.
Yeah, thank you. So anything that you would like to add?
Yeah, in obesity, it's more important is when we go for hypertension, diabetes or PCOD treatment, treat those diseases, it is important. At the same time, we also need to check that, am I obese? If obese, that is the cause for all those disease. For that reason, check your BMI and treat the obesity from the start.
Thank you. Now with this of course, we are representing the viewers. So the next question would be, what are the options that are available to treat obesity? And I would like to put this question to Dr. Jankar.
Obesity simply can be treated with a good lifestyle and good diet. That I think you are the expert in the diet problems. Diet and the lifestyle is a cornerstone of treating the obesity, but every obese patient or morbidly obese patient doesn't respond to the diet. At the same time, when you are obese and associated complication, diet may not be completely going to help you. In that scenario, there are availability of medical treatment for particularly obesity or associated complication, and also there are availability of surgery coming from the endoscopy to laparoscopy. Many options are available.
Right. So now we know that there are options that are available. Now the next question, ma'am, to you would be that what are the medications that are used for the treatment of obesity, and what is the safety to it? Because when we see our today's population, there are so many shakes, so many supplements, so many tablets, and India particularly, we've got a lot of other disciplines which offer, the treatment options for obesity. So would you guide us on, what are the medical options and when to use those options for treating obesity?
Okay. So yes, there are lots of options available, some regulated, some unregulated. Like you said, you get tablets posted to you from Amazon, and you think this is going to help you. But what you want is professional advice. So once you know that you are obese, and particularly if you have complications related to obesity. So obesity, as you said, is excess weight, and so it's going to put a pressure on the heart. You get high blood pressure, heart problems that you may not be aware of. Sometimes you are aware of it, and high blood pressure is probably the commonest example, as Dr. Jankar mentioned. But there can be other things like diabetes, which is very common, and diabetes and obesity are commonly seen together. You may have liver problems, you may have period problems, you may have multiple other problems. So it's important that you first get yourself seen by a professional who is an expert in obesity, knows about various treatments that are prescribed medications. They are regulated medications, they can have side effects, they may not be appropriate if you're taking various medications to take them with. So you see a specialist who will tell you what medications are suitable for you. It will also be determined by the degree of obesity you have. So how obese are you? Do you have complications? And so how much do we need to reduce the weight by? And so that's that will determine. But the point is, do not take anything that you don't know what it contains, what the side effects may be. Is it appropriate for you? So see a specialist and then get the appropriate advice.
Thank you so much, ma'am. So now, knowing about the medications and you being a bariatric surgeon yourself and you've treated so many patients, so I would also want initially you to say a few words how the adverse effects or any such incidences you have seen into your practice, and also when does surgery come into picture for treating obesity? Because see, when our viewers see it, surgery always it's a cut given to the body, so they are afraid how safe are these surgical procedures, and also a lot of surgical procedures are there to treat obesity. So what is the most appropriate one, and when is it appropriate to undergo the surgery?
Coming to your first question, what we are seeing is the person suddenly realize that I am obese, and then he will start googling. That time he will come to exposure of many kind of medication, and suddenly the person forget that there is expert who is like a madam endocrinologist who will take care and dedicatedly they can guide, rather than person start taking the medication which are not prescribed by the expert. And we have seen many of the patients trying to reduce drastically weight, landing into the liver and kidney problem. That practice should be avoided. And coming to your question, being a surgeon, I see many of the people afraid of surgery. Obesity surgery, rather than that, we call it as a metabolic surgery. Obesity surgery at this point of time is absolutely safe. These are daycare based surgery, 1 or 2 days. You stay in the hospital, you get the surgery done. It's not about the cutting the stomach and leaving, it's about the changing your physiology. If you see obese person, if he has a 35 BMI, 6 months he tries lot of weight to reduce, and suddenly after that he leaves and he will be more than what he has started. That is called something pendulum effect, where his body BMR has set point, that is some set point is there. For higher obesity patient associated with some complications such as BMI more than 30, associated with some diabetes, uncontrolled hypertension, or BMI more than 40, in that medical will help. But those patients where surgery will create the magical impact. By doing the surgery in short period of time, you can lose your excess weight even up to 80 to 90%. And most important, in higher obese patient doing the surgery, these are not going to come back if you maintain your life and good healthy lifestyle. So I can tell the surgery at this moment of time, because of revolution, it is safe. They can be done as good as your appendix and gallbladder and hernia surgery, and results are amazing. We have seen many of the patients who is getting the results.
Absolutely, sir. So we are into our lecture series or YouTube series, and we definitely have your valuable advice. I'm sure that today's video has helped us to clear out a lot of myths relevant to the medications or the surgery aspects, which is of value to our viewers. Just to summarize you both, it's important that you start seeking the advice as early as possible. Very simple to calculate your BMI, and the moment you get to know that you're obese, it's the time that you start taking treatments and seek advice from medical experts. And we have 2 of our medical experts with us. We hope to see you very soon. I mean, if at all you require any medical advice, we would be happy to see you at our clinics, at our OPDs. And we take a break here. We also would be coming back with our next YouTube series, clarifying a lot of things relevant to obesity in different aspects. If you have got any comments or questions, we would like to include them into our YouTube series. Please post your questions into your comment box, and we meet you soon again. Till then, please take care of your health and have a good day. Thank you.